An injury is not normal. I continue to see the idea presented that ankle injuries and knee injuries, they just happen, and it's just part of playing basketball. And to a certain extent, it is. You can't avoid all injuries, but I would say that an injury is abnormal. So something happens to cause that injury. So that could be something accidental. So I land on somebody's foot and sprain an ankle, or I catch an elbow to my nose and I break my nose, or I catch a ball poorly and I jam my finger. These are all accidents that happen, but again, it's abnormal. It's not something that happens on a regular basis, and should contribute to injuries frequently. These are abnormal situations. Injuries can also happen from other forms of or other problems. So we could have problems with our training plan. We could have problems with our movements. We could have problems with our with overtraining. We could have problems with undertraining. We could have problems from a lack of recovery. We could have poor nutrition, poor hydration, poor sleep patterns. A lot of stress. So injuries tend to increase during midterms and finals because the added stress, which also likely leads to sleep deprivation, which tends to be associated with increase in injuries as well. There's also research that shows that if somebody suffers a concussion, which certainly an accident happens, hopefully it was an accident in basketball, and you hit your head or something, you suffer a concussion, but your susceptibility to injury, like a muscular injury, will be increased over a period of time of, I believe, something like 6 months. Your susceptibility to another injury is increased just because of the concussion, beyond any cognitive effects related to the concussion. So there are other ways beyond these kind of accidents that one can suffer an injury. But a lot of these things are under our control, whether from an athlete standpoint or a coach's standpoint. So we can help to reduce injuries if we teach better movement. So if players can run and stop, if they can jump and land, if they can change directions appropriately, these are all skills that players need to perform well, but also to reduce their opportunity for injuries. Because if I run poorly, I'm adding stress to a system and I'm likely going to break down somewhere. If I land from jumps poorly, I'm more likely to potentially tear an ACL, sprain an ankle, or maybe develop an overuse injury such as knee tendonitis because I'm adding stress to the system. If I'm not sleeping or if I'm stressed from daily living, I might suffer an injury. That's something that's potentially within my control. I can make an effort to increase my sleep, and that might just mean a matter of, time management. I might have to cut something out of my life if being an athlete is important to me. Poor training. So last year I would get some players who came to me when they were injured. So they would start to feel pain and eventually got to be an injury, and so they stopped playing. And rather than sit on the sideline and ice their injury, the coach called me and I would work with these athletes. And what I found is they all had poor movements. But more than that, when I asked some questions, I found out not only did they have poor movements, but they were so talking about movements, they couldn't squat correctly. To me, they could not get into a good bottom position on the squat. They couldn't hold a good bottom position on the squat. They had poor technique, and they had compensations involved in trying to squat. Basically they should not have been squatting in the weight room, but when I spoke to them, they were squatting in the weight room. They were doing back squats, sometimes even heavy back squats for them, and I looked at them doing body weight squats and they couldn't do a body weight squat. So now we're loading a poor movement and surprise, surprise, we end up with injuries. Another factor could be the overtraining. So if some of these same players were still suffering from injuries from 2 seasons before, when their coach had so overtrained them that they developed even acute injuries from the overtraining, stress fractures, to the tibia, because they were overtraining to such an extent with this basketball coach. So the overtraining can cause an injury, and the residuals from that injury can lengthen the time of recovery or lead to subsequent injuries. So the stress fracture ended up leading to reduced ankle range of motion, which then caused knee pain. Okay, so it all went back. It went back 2 years to the overtraining, which caused a stress fracture, which led to reduced ankle range of motion, which the player actually ended up missing time because of knee pain. So again, that injury is abnormal. A lot of things went wrong for that player to get to that point. And it was a combination of things in terms of poor movement, being overtrained, under-recovered, and then loaded, and continuing that cycle until the player just broke down. So we can't look at these injuries as just something that happens. The player got injured, they play basketball, it happens. They play soccer, of course they got injured, it happens. If we see an injury, we need to examine it, because it's either an accident, such as landing on somebody's foot, and there's probably stuff that we could do to reduce the time missed due to that injury if we take a proactive stance. So it's some form of accident, or something went wrong either with the individual in terms of the way that they move, or how they train, or how they recover, or how they sleep, stress, these kind of daily living type of things. Or something's wrong with the training program. Either the coach is loading a poor movement, or the coach is simply overtraining, too much volume, maybe too much training off the court at the same time, let's say in season, when the team is practicing 2 to 3 hours a week and we're still doing an hour and a half of conditioning off the court. It's probably too much volume, especially it minimizes the amount of time that player has to recover. So we're likely in an under-recovered state with too much volume in training, and eventually that's going to lead to breakdown. And when you see 12 out of 15 players on the team have some injury, or at the worst some major compensations, you can probably tell that something's wrong with the training going on with that team. So again, injuries are abnormal. We can either identify some form of accident happened, or there's something going on either in the player's life, the player's training, the player's basic movements, or the overall training program and coaching program that the player's engaged in. And so we need to examine these things, and especially in basketball at the high school level, a lot of the problems exist because players are playing on multiple teams. Probably not each coach isn't aware of how much that player is exerting effort, or how much volume they're getting with a different coach. And so the combination of a lot of volume can then lead to injuries, especially if we have adolescents who, especially right after a growth spurt, they're a little bit uncoordinated. They have to relearn some good motor patterns. And now we're giving them tons of volume by having them play on multiple teams. Maybe not spending enough time working on our basic movements and basic motor patterns. Recipe for injury. It's not hard to see how players get injured in these environments. What's hard to understand is how we can continue to see these injuries and just call them something that just happens. We need to spend more time examining them, and examining our own training, and then examining what could be going wrong with that individual athlete in terms of daily living, and then also their basic movements that they bring into the sport.